Hello and welcome. And I'm really pleased today we're going to be talking about the London Medical Conference 2024 that will be taking place on between the 19th and 20th of October at Queen Mary University, Mile End in London. And I'm really pleased I have Dr. Sunny Onzi and Dr. Letitia Moshui, who are going to talk to us and give us some insight into which is going to be, I think, quite a path-breaking event. So good day to you both.
Thank you. Thank you for having us, Rudy.
Thank you. Thank you.
Yes, thank you.
So, Dr. Sunny, starting with yourself, the London Medical Conference is known for bringing together some of the brightest minds in healthcare. What key topics or breakthroughs can attendees expect to learn about this year?
Well, the upcoming London Medical Conference is all about people. It's all about practitioner and the recipient of those services. The conference is designed to bring together the brightest mind in the medical field. The world of about over 8 billion people is sick enough. Scientific discovery have shown that over 90% of people have one form of medical condition or the other. So this conference is designed to bring together, to sharpen practitioners, doctors from all walks of life, psychologists, therapists, so that they can come together and learn what are the latest developments in the field of health and wellness. It's also going to be exploring how emerging technologies will support the medical practitioner in the area of the various practice and practices, so that they'll be able to see and support their client and their patient. Yes, it's truly transformative. It's all about education in the field of healthcare.
Yes, and some of the topics that we'll see there will be things touching on advancements within the NHS when it comes to looking after gynae issues. So we have NHS consultants talking about that. And then there'll also be advancements in brain restoration as well. We'll have a Canadian doctor who will be coming to speak about how you can restore the brain through new age technologies and new age ways from after having had some brain injuries. So it's going to be amazing. And then we'll also have very unconventional thought processes as well coming into play there, with a very top Indian doctor talking about how disease can also be of benefit to some people, which is kind of mind-blowing when you think about it. It's very contradictory too, but let's see.
Excellent. I think I read somewhere about prostate health, because obviously that's of significant interest to all people of African and Caribbean population groups. Latin American is really important. Is there anything you can inform us about that?
Yes, like I said to you, Rudy, earlier, a lot of the topics are going to be very insightful. Mm-hmm. And as you mentioned about prostate, yes, a lot of men, me inclusive, we're very reluctant to go and seek those medical help. And part of the topics that we'll be discussing will be men's and women's health. Yes, and why it is critical that a man, yes, you're a man, but you're not stronger than the illness or a medical condition. There is a necessity and there's a determining factor for you to seek that help at the earliest opportunity. So this conference will unveil a lot of part of these subjects and the development that will be taking place at this particular upcoming London Medical Conference 2024.
Excellent. So for someone considering attending the conference for the first time, what would you say makes this event a must attend for medical professionals, researchers, and even students, of course?
Correct. The students are going to be the generation to come in terms of health and wellness. So it is compelling for this particular student to learn from their father, metaphorically speaking.
Yeah.
Also have been in the industry of health and wellness for the last 30 years, 40 years. And children will bring a different dimension, a blend of technological development, because these are some of the, as you say, the Gen Z, they bring about the technology natives. So they bring about, so the infusion of the older generation within the medical field with the younger generation will make the world a better place. Yes, the purpose is that technology brings about proximity and application of increasing application of technology in health will benefit not just a select individual country, but globally, as doctors and healthcare practitioners will now have tools that will enable them to look after more and more people that are geographically dispersed around the globe. Isn't that amazing?
Yes,
it really is.
And if you are a health fanatic or you're even just in the health field, then you need to come. It's a complete must attend for you, because in one sitting, you'll be able to see senior NHS consultants, senior doctors from all walks of the world, top doctors in Dubai, top doctors in Canada, top doctors in India, and some of the doctors in the UK as well. So it's a real combination of the best of minds coming together in one place. How can that not be a reason for you to attend?
Absolutely. And I think what I particularly like about the sound of this, we're in 2024, of course, and there's a big movement in terms of the acceleration towards the sustainable development goals. And of course, health and sustainability and, and more work being done to improve the livelihoods of all people. So I think that this is significant in terms of as an event, an important event, particularly being here in London, given the role of London and within the context of the, the global economy. And so I think this sounds really great from a healthcare perspective.
Absolutely.
So how does the London Medical Conference help bridge the gap between cutting-edge research and practical real-world medical applications? So people like myself, we're interested in the implementation. So how does that work within the service area, within those busy directorates, where the decisions are being taken, as we say, the clinical lines, the systems, the accountability, the communication, the assurance, where those decisions are made at the front line?
Well, the current narrative of medical practice around the globe is over 100 years old.
Mm-hmm.
You cannot drive a car that is 100 years old that has not been improved, or a house that is 100 years old that has not gone through dilapidation. So there has to be improvement, there had to be adjustments, and there had to be some movement in terms of innovation and improvement. Current medical practitioners are really working very hard. We travel the world, we have seen some of them are working without resource. Some of them are working without being. We live in a country, in England, where we're fortunate that the NHS is a jewels that many countries like to, it's a coveted organization. But still, we have our own challenges, right? Currently, we have over 7 million people on the waiting list, over 7 million. If we use the current narrative, let's say nobody's going to be ill at all, we stop at where we are right now. it would take over 37 years to be able to achieve this primary patient to be looked after. We're not talking about all the other complexity. So the emphasis of this particular conference, the emphasis on education of how technology can bridge that gap so that we can sponsor, we can look into, we can explore various opportunities and possibility of increasing application of AI and other technological advancements in order to support medical practitioners. Gone are the day whereby you have to go to a hospital and waiting for A&E, accident and emergency, for a very long time, having to travel to so many faraway distances before you can see a practitioner. So what this particular conference is all about is saying, how can we as practitioners develop and envelop the medical profession so that the common man and woman on the street far away can have access to a practitioner at the press of a button. Yes, truly, technology brings about proximity. So the conference is going to unearth, going to unveil how these researchers can improve their own researching techniques and methodologies in terms of actually full application of IT. People always say to me, Rudy, they say, oh, if IT actually comes on board, then there's going to be occupational usurpation. Mm-hmm. What that really means is that they think that once technology is actually brought about, doctors are going to be unemployed. I say no. Doctors and technology have to work together. Technology cannot replace our doctors. Our human doctors are imperatively important to our provision, to the narrative of medical dispensation, without a question. The technology will provide the tools necessary for the doctor to be able to perform his or her work effectively and efficiently. So the cutting edge part of the conference is all about unveiling some of this information and education so that the doctors are coming to learn, they're coming to share, and they're coming to connect in the process.
Yeah, it's a real fusion of ancient traditional practices that we've seen that continues to take place with new age technological methods and practices. So it's really something that is bringing freshness to the way that conventional medicine is approached. So only when you come, then are you able to really understand what we're talking about here, because each speaker has something fresh to give you, something that you haven't quite heard before. Mm-hmm. And we know that when it comes to advancements, whether it be in healthcare or it be in technology, the general public are usually always about 15 to 20 years behind. So when you come to a place where all these bright minds, all these pioneers in the industry are coming together and really discussing and teaching us on the advancements that's taking place and how we can prepare for it, then you know you're in the right place to come and really connect with these people. So yeah, that's really what I think is a great seller for us and how we bridge that gap.
Very interesting. I'm going to go back on a couple of things that you said earlier on, Dr. Sani, which I think are really important for a discussion such as this. The first being, as you indicated, the NHS. The first line in the NHS constitution says, the NHS belongs to all the people. And so it made me think of the patient voice. So what role has the patient voice got within this particular conference?
Okay, the conference is designed to be attended by practitioners and also the patient, the recipient,
yes,
the beneficiary.
Yeah.
So you have the benefactor, which are the practitioner, the doctors and therapists, psychologists. Then you have the beneficiary, which are the members of the audience.
Mhm.
So what the conference is providing, remember what I said earlier, is all about education,
Mhm.
education within the medical and health and wellness field. The increasing awareness and participation of patients in their own health and wellness field is what the NHS is actually promoting right now. And this particular conference is just those parts of avenues, those parts of geographies, those parts of places where a patient as attendee can get a lot of information, what their rights are, what form of therapies they can seek. It improves their choices and increases it. It transforms the way healthcare is being practiced. Gone are the day where the doctors are the father, of the medical field. They tell you what you need to accept. But it has come to a time right now that a client or a patient can challenge the medical narrative that is being administered to their own system. So this conference is an empowering conference, information platform that enables people to actually see what they can do, what they cannot do. It improves choices in terms of what medical narrative they need to see. Do they need to go for the Chinese? Or do they need to go through homeopathy? Or do they need to go really for the traditional way? As Letitia mentioned earlier, is an infusion of the traditional practice with modern day. So it's all about the blended strategy, health and wellness.
Yeah, and also again, and I guess Letitia, you might want to come in on this. We've got the aspect, as Dr. Sunny has mentioned, about the rights in terms of patient and public, but of course, we also talk about the responsibility, self-care, self-management, healthy living lifestyle, diet, nutrition, sleep, all those kind of things. And of course, there's the traditional and, medicines and food stuff. So will there be much of that blend in terms of information sharing, in the sense that, of course, prevention is better than cure?
Absolutely. And we do have doctors who will be there talking about, who are dietitians as well, talking about various diets that you can incorporate into your daily habits. And we also, as Dr. Sunny was mentioning before, we have information from the patient perspective. I will leave this one as a surprise, but last year we had a health ambassador who works quite closely with an NHS trust in Birmingham to really go out and advocate from a patient perspective. And he's so knowledgeable, and the way that he presents it is relatable to the general public. So we do consider all aspects. It's not just the top medical professionals telling you about your health, but we also have the patient themselves coming up and talking about it from their perspective. So it's we really look at the whole holistic approach here.
Excellent, because again, you've mentioned that word, which of course is essential as the system moves to much more of community services. Relatability is so important. Cultural understanding, the co-learning, the co-design of services, the public will accept and get involved in. So that sounds really excellent. So Dr. Sunny, what role do you think conferences like this play in fostering collaboration across different medical disciplines and encouraging global advancements in healthcare?
Well, this conference, like I mentioned before, is all about education, what I call CPE, continuing professional education. education is all part of life, so part of learning, so part of personal and professional development. Without education, we're not talking about somebody simply going to university. We're talking about somebody exposing themselves to new things, to new invention, to new events. Doctors are working at a high pace, and things are changing because our body go through so much reaction. Some scientific discovery actually describe our body as the most complex machine in the universe. It's so intricate, so complex. So one narrative or one form of intervention doesn't provide the whole solution to our body complexity. So on the base of this, the doctors and the patients alike will use this platform as an educational platform that brings together. So you're not just going to have one directional intervention, you're going to have multifaceted, multi-sectoral intervention that will enhance and will transform the way the medical management is being practiced, not just in the UK. I mean, UK is one of the most advanced, medically advanced country, and we still have a lot of issues, a lot of challenges. So you can imagine what happens in other parts of the globe. So the purpose of this conference is we are now inviting everyone, the main DMUs, main decision makers within the healthcare from various countries to come and peer into the good thing that the London Medical stands for. That's why right now we've invited a lot of universities from all over the world, embassies from all over the world, so that they can ask their own medical Ministry of Health to attend, send delegation to actually see how collaboratively we can support the medical and particularly to serve the underserved medical community around the globe, currently, which is estimated by World Health Organization of over 3 billion people. So we now believe that with the increasing application of technology, and doctors and practitioners are coming on board to learn all of these things, we can serve and support humanity for preventative and curative if that the situation has got worsened, if that the intervention is required. But prevention, as the saying goes, is better, but I will also add, prevention is also cheaper than cure. So it is better to nib it, at the grassroots level. And this is what this conference is all about.
And we're essentially, when you think of the fact that we're working closely with universities and embassies across the world, well, you can call us an education hub, because we are transferring information that we're gathering from the experts and passing that on to the students, the medical students, the future of healthcare, because these are the young people, are the ones who are going to become the future of our healthcare. So when we are keeping them in the loop, we're actually helping them, because some of the knowledge that we are discussing here in this conference is not even taught in the schools just yet. So this is really a platform where they can come, I'll just call it an education hub, come and learn the things that are not being taught within their universities, so that they can be better prepared when they come into the world of work, and when they finally have to do their essays or their dissertations, they've got something fresh to add to it.
Excellent. And I think what I really take from this part of our conversation, which is really important, that this event is a sharing the learning event. Absolutely. Also, you're blending what we call the 21st century learning and skills of collaboration, creativity, communication, critical thinking, and then at the same time, encouraging people then to go away and create their communities of practice, you know, put the issue to be addressed in the center and think about how they're going to innovate in their existing systems, wherever they may be. And I think, again, that's such a great area for research development, academic research, but also how we have our academics now start to work with our community researchers as well, and bringing together that academic community research, which then gets translated into implementation to deal with the system issues as well as the practical health issues that you've already described. So I think this is a significant event in itself.
Absolutely. And, you know, we talk of the digital age, but I actually feel that we're moving from the digital age into the age of AI. This is beyond just computers. This is something much more. And if we can bring everyone on board, then no one gets left behind. Like Dr. Sunny mentioned earlier, some doctors are afraid that AI is coming to take over their jobs, but no, it's the ones who are ready and willing to learn and ride that wave that will be able to then advance in their careers. And anyone who's still very old-fashioned and wants to stay in their conventional way of thinking, well, I'm afraid they're the ones who will be left behind.
Yeah, but not only that, that's not going to reduce the health inequalities. So that's the important thing in the end. Ultimately, it's about access, experience, outcomes, and we have significant health inequalities that need to be dealt with. So
and
that's
the
why
way that
is important.
Yeah, absolutely. And the way that we work is we work in a way that enables for people from anywhere in the world to be able to benefit from what we do as well. We have a technology that is able to scan people remotely from the comfort of their home. So no matter where you are in the world, you're able to access quality healthcare. You can be in Gabon, you can be in China, you can be in New York, you can be anywhere and have a doctor also likewise anywhere in the world, and only at a very fraction of the cost with minimal waiting times. So we are working here with the communities and understanding what the needs are for the people. We know how long it takes to even have a scan with the, you know, as good as they are, the NHS. It takes a very long time before you can be referred to have a scan. And when you do have a scan, sometimes that could take months before your appointment is even given to you. So the way that we're working is really including the entire community and bringing them on board with this new, the new changes that we're making. We really take on the perspectives of the community, and we look at how is it that we can help them and also provide a holistic approach. Like we were saying, you know, we are a sister company to the School of Bionatural Medicine, which means that through that organization, we're able to provide something that is for absolutely everybody, because we have to face it. Everyone needs healthcare at some stage, whether you're just born now, and sometimes even fetuses, they need healthcare, you know, or whether you're 125 years old, whatever it may be, you could be a doctor, and at some stage you will still need healthcare. So we really look at what the world needs in this moment, and that's how we then develop our systems and our processes and practices to be able to cater for all.
Right, and I just might make one quick point around that, because the other important point that you're making, by the use of technology in its global sense, it also means that there isn't that loss of cultural understanding, cultural competency, because you can still access the professionals who understand, you know, and which again is really important in terms of to reduce the health inequalities and people having confidence to access the service that will meet their needs. So coming to the final question, Dr. Sunny, with so much changing in healthcare and technology, how important is it for medical professionals to stay updated, and how can attending this conference contribute to that ongoing education?
Well, as you know, Rudy, if you don't learn, then you will die. The British Prime Minister Keir Starmer says NHS has to learn or it will die. It had to revive itself. It had to rejuvenate. It had to be transformed or it will die. If we don't absorb taking on knowledge from time to time, then it's very, very difficult for us to learn new things and bring about new interventions. I mean, the medical practices that were practiced during the time of the Egyptians, the Assyrians, the Babylonians, the Romans, back in 2,000 years ago, even 500 years ago, even 50 years ago, are no longer operative. They're no longer functional today. So we need to go to 2024 and beyond within any medical field. We need to educate ourselves. Otherwise, the system of medical practices will replace us, will become dilapidated. We're out of function. If we're out of function, of what use are we to ourselves and other humans on the planet? So gone are the day whereby we stuck to one narrow narrative of intervention. So it is a time now where we need to foster partnership between the different providers. It is time now whereby we need to provide the recipient, the beneficiary, those human rights of making their choices on what is best for them. It is time to emphasize preventative strategy rather than curative strategy, because if you're going through the curative strategy, it's too late at that point in time. So these are upcoming conferences. This is all about how you can take these proactive steps, how we can bring about learning into the classroom environment by the infusion of older generation and the younger generation learning from each other, which is what I call strategic interdependence between all the practitioners. And the client or the patient that will be attending also will have that, again, to be able to ask questions, see how they can support themselves and their own loved ones in terms of what is the medical issue that is actually taking place. So it's all about bringing in medical practices at the point of impact to those who actually needed the service. That's what the upcoming School of London Medical Conference is doing. Letitia has already mentioned about the School of Bio-Natural Medicine. This is all about where we disseminate education in the real terms in the classroom to all medical practitioners who are available, who avail themselves to the opportunities and the possibility to be educated in new ways of research, particularly in areas of using technology in the right way to enhance and transform medical practices now and beyond.
Letitia, would you just like to finally provide us with all the access details?
Absolutely. So to attend the conference, just visit our website, londonmedicalconference.com. I can certainly share the screen here so you can see what the website looks like. Just so you know, when you've landed on it, you know that you are on the right website. You should be able to see it now. So this is what the website looks like. When you come onto it, then you can click whether you want to exhibit, whether you want to speak, or just simply register to attend there. Once you click register to attend, then if it lets me scroll down, yes, here we are. So then you'll be able to book now. So you click on that, and that will be able to take you to our Eventbrite link where you can register to attend, and also you'll find another link there with a ticket there to also exhibit. Exhibition cost stands at just £300. We wanted to make it as affordable as possible. But yes, we do welcome you. If you have any questions for us, then just email us at info@londonmedicalconference.com, and one of our representatives will get back to you.
Thank you very much. And it sounds like an excellent event, and look forward to seeing you there. Thank you and goodbye.
Thank you, Rudy.